Question 1. A patient is admitted with Escherichia coli, E. coli, sepsis, acute renal failure, and septic shock. What is the correct code sequencing? A. R65.21, A41.51, N17.9. B. A41.51, R65.20, N17.9. C. A41.51, R65.21, N17.9. D. N17.9, A41.51, R65.21. Answer: C. A41.51, R65.21, N17.9. This question tests your knowledge of coding sepsis with organ dysfunction and septic shock. The keyword sepsis is crucial, and the index directs you to code the specific type of sepsis first, A41.51 for E. coli sepsis. When sepsis is associated with septic shock, a code for severe sepsis, R65.20, or severe sepsis with septic shock, R65.21, is also assigned, following the sepsis code. Since shock is present, R65.21 is correct. The acute renal failure, N17.9, is coded last as the associated organ dysfunction. Remember, for sepsis cases, always look up sepsis in the index first and follow the sequencing and additional code instructions carefully. Question 2. A patient is seen with symptoms diagnosed as acute viral gastroenteritis. What is the appropriate ICD-10 CM code? A. K52.9. B. A08.0. C. A09. D. K59.1. Answer: B. A08.0. This question asks for the code for acute viral gastroenteritis, an infectious disease of the intestines. The key phrase is acute viral gastroenteritis. Navigating the index under gastroenteritis, viral leads you to codes in the A08 category. A08.0 specifically describes rotaviral enteritis, which is a type of acute viral gastroenteritis. While A09 is for unspecified gastroenteritis, and K codes are for non-infectious digestive conditions, A08 provides the specific etiology stated in the diagnosis. Always strive to code to the highest level of specificity provided in the documentation, especially regarding the cause, etiology, of an infection. Question 3. A patient with known human immunodeficiency virus, HIV, disease is diagnosed with candidiasis of the mouth. What is the correct code sequencing? A. B37.0, B20. B. B20, B37.0. C. Z21, B37.0. D. B37.0. Answer: B. B20, B37.0. This question tests the coding guideline for HIV-related conditions. The keywords known human immunodeficiency virus, HIV, disease, and candidiasis of the mouth are essential. The guideline states that when a patient has an HIV-related condition, the code B20, human immunodeficiency virus, HIV, disease, is sequenced first, followed by the code for the HIV-related condition, in this case, B37.0 for candidiasis of mouth. Code Z21 is only used for asymptomatic HIV status, which isn't the case here as the patient has HIV disease. Remember that B20 is almost always the primary diagnosis code when an HIV-positive patient is being treated for an HIV-related illness. Question 4. A patient presents with a skin abscess on their arm caused by methicillin-susceptible Staphylococcus aureus, MSSA. What is the correct code? A. L02.419. B. L02.419, B95.61. C. L02.419, B95.8. D. B95.61. Answer: A. L02.419. This question requires you to code a localized skin infection with a specific causative organism. The keyword is abscess and the organism is methicillin-susceptible Staphylococcus aureus, MSSA. When coding localized infections like abscesses, carbuncles, and furuncles classified in Chapter 12, diseases of the skin and subcutaneous tissue, you typically only need the code from Chapter 12 that describes the condition. The codes in Category B95, B97 are used as additional codes to identify infectious agents in diseases classified elsewhere, but are not required or appropriate when the Chapter 12 code fully describes the condition, including whether it's staphylococcal. Code L02.419 describes cutaneous abscess of upper extremity. Always check if the code for the condition already implies the common bacterial cause or if an additional organism code is needed per the guidelines. Question 5. A patient is diagnosed with acute and chronic sinusitis due to a bacterial infection. How should this be coded? A. J01.90, J32.9, B99. B. J01.90, J32.9. C. J01.90. D. J32.9. Answer: B. J01.90, J32.9. This question asks how to code both acute and chronic forms of the same condition when present. The keywords are acute and chronic sinusitis and bacterial infection. While Chapter 1 codes deal with infectious diseases, sinusitis codes are typically found in Chapter 10, diseases of the respiratory system. However, this question tests a general coding principle often encountered with infections involving body systems. When both acute and chronic forms of the same condition are documented, and the ICD-10-CM alphabetic index does not provide a specific combination code, you should code both the acute and chronic forms. J01.90 is for acute sinusitis, unspecified, and J32.9 is for chronic sinusitis, unspecified. An additional code for the bacterial agent, B99, would only be used if the specific bacterium was identified and needed for documentation, but it is not required to code the acute and chronic states. Always check the index and tabular list instructions for guidance on coding acute and chronic conditions occurring together. Question 6. A patient presents with cough and fever. After examination and testing, they are diagnosed with community-acquired pneumonia due to Streptococcus pneumoniae. What is the correct code? A. J18.9, B95.4. B. J13. C. J18.0, B95.4. D. J13, B95.4. Answer: B. J13. This question requires coding pneumonia with a specific bacterial cause. The crucial information is community-acquired pneumonia due to Streptococcus pneumoniae. ICD-10-CM provides combination codes for pneumonia where the infectious agent is known. Looking in the index under pneumonia, streptococcal directs you to J13, which is the combination code for pneumonia due to Streptococcus pneumoniae. Using J18.9, unspecified pneumonia, or J18.0, bronchopneumonia, unspecified organism, with AB code for the organism, B95.4, is incorrect because the combination code J13 exists. When a specific combination code is available that fully describes the diagnosis, condition plus organism, use that code instead of coding the condition and organism separately. Question 7. A patient is diagnosed with type 1 human T-cell lymphotrophic virus, HTLV1, infection. What is the correct code? A. B87.8. B. B97.36. C. C91.50. D. B87.0. Answer: B. B97.36. This question asks for the code for a specific viral agent, HTLV1, causing an infection. The keywords are type 1 human T-cell lymphotrophic virus, HTLV1, infection. Many viral agents are classified in the B97 category, viral agents as the cause of diseases classified elsewhere. Looking up HTLV1 in the index directs you to B97.36. Codes in B87 relate to myiasis and other infestations, and C codes are for neoplasms. While HTLV1 can be associated with certain cancers, the code B97.36 identifies the virus itself as the cause of an infection. Remember that codes in categories B95, B97 are used to identify the infectious agent, often in conjunction with a code from another chapter specifying the disease caused by the agent, but in some cases, like this one where the diagnosis is just the infection with the virus, the B code is used alone. Question 8. A patient is admitted with urinary tract infection, UTI, caused by E. coli. What is the correct code sequencing? A. N39.0, B95.6. B. B95.6, N39.0. C. N30.90, B95.6. D. N30.00, B95.6. Answer: A. N39.0, B95.6. This question involves coding a urinary tract infection with a specified bacterial cause. The keywords are urinary tract infection, UTI, and caused by E. coli. The code for an unspecified site UTI is N39.0. Since the causative organism is specified as E. coli, and N39.0 does not have a built-in code for the organism, an additional code from category B95, Streptococcus, Staphylococcus, and Enterococcus as the cause of diseases classified elsewhere, is used. B95.6 specifies Escherichia coli as the cause. The guideline states that codes in B95, B97 are additional codes to identify the infectious agent, meaning they are sequenced after the code for the condition itself. Question 9. A patient is diagnosed with influenza due to avian influenza virus. What is the correct code? A. J10.00. B. J11.00. C. J09.x2. D. J10.08. Answer: C. J09.x2. This question asks for the specific code for influenza caused by an avian influenza virus. The crucial terms are influenza and avian influenza virus. Chapter 1 contains specific codes for influenza due to certain identified influenza viruses. Looking in the index under Influenza, Avian directs you to codes in category J09. J09.x2 specifically covers influenza due to identified avian influenza virus. Codes in J10 and J11 are for influenza due to other identified or unspecified influenza viruses, respectively. Always use the most specific code available when the type of influenza virus is known and documented. Question 10. A patient is admitted with sepsis due to a central venous catheter-related bloodstream infection. The organism is not documented. What is the correct code sequencing? A. T80.298A, A41.9, R65.20. B. A41.9, R65.20, T80.298A. C. T80.298A, A41.9. D. A41.9, T80.298A. Answer: D. A41.9, T80.298A. This question involves coding sepsis linked to a medical device. The keywords are sepsis due to a central venous catheter-related bloodstream infection and organism is not documented. When sepsis is associated with a non-surgical medical device, like a catheter, the guideline instructs you to first code the sepsis, A41.9 for unspecified sepsis since the organism isn't known, and then the code identifying the infection due to the device, T80.298A for other infection due to central venous catheter, initial encounter. While sepsis can lead to severe sepsis, R65.20, the question doesn't document severe sepsis or shock, only sepsis itself. The device-related complication code is sequenced after the sepsis code because the sepsis is the primary reason for the encounter, caused by the device issue. Question 11. A patient has a history of tuberculosis, TB, but is currently not experiencing active disease. A follow-up visit confirms inactive tuberculosis. What is the correct code? A. A15.0. B. Z86.11. C. Z22.8. D. B90.9. Answer: D. B90.9. This question asks for the code for inactive tuberculosis. The keywords are history of tuberculosis and inactive tuberculosis. Inactive tuberculosis, often referred to as latent or healed TB, is coded using codes from category B90, sequelae of tuberculosis. B90.9 specifically covers sequelae of tuberculosis, unspecified. Z86.11 is for a personal history of tuberculosis, used after the sequela has been coded or if there are no current residual effects coded elsewhere. A 15.0 is for respiratory tuberculosis, confirmed bacteriologically and histologically, which is active disease. Z22.8 is for carrier of other infectious diseases. The guideline for coding sequelae directs you to use the sequela code first, often symptoms or conditions resulting from the healed TB, followed by the B90 code, but if the documentation simply states inactive TB without specifying residual conditions, B90.9 is the appropriate code representing the healed state. Question 12. A patient presents with vomiting and diarrhea due to Norwalk virus. What is the correct code? A. A08.1. B. A09. C. R11.2. D. B97.89. Answer: A. A08.1. This question requires coding gastroenteritis caused by a specific virus. The keywords are vomiting and diarrhea due to Norwalk virus. Vomiting and diarrhea are symptoms, R11.2 and part of A09, but the cause is specified as Norwalk virus. Chapter 1 includes codes for viral intestinal infections. Looking under infection, intestinal, viral or gastroenteritis, viral, Norwalk in the index leads to A08.1, acute gastroenteropathy due to Norwalk virus. A09 is too general, unspecified infectious gastroenteritis, and B97.89 is used for other specified viral agents causing diseases classified elsewhere, not when there is a specific combination code like A08.1 available. Use the combination code that links the condition, gastroenteritis, to the specific organism, Norwalk virus, when available. Question 13. A patient is diagnosed with disseminated candidiasis. What is the correct code? A. B37.9. B. B37.7. C. B37.89. D. B37.6. Answer: B. B37.7. This question asks for the code for disseminated candidiasis. The key term is disseminated candidiasis, meaning the fungal infection, candidiasis, has spread throughout the body. Codes for candidiasis are found in category B37. Looking in the index under candidiasis, disseminated directs you to B37.7. Other codes like B37.9, unspecified, or B37.6, endocarditis, are for specific or generalized forms, but B37.7 accurately reflects the disseminated nature of the infection. When a specific term like disseminated is used in the diagnosis, always look for a corresponding code in the index and tabular list. Question 14. A patient has a positive tuberculin skin test, TST, but no evidence of active disease. What is the correct code? A. A15.9. B. R76.11. C. Z22.8. D. B90.9. Answer: B. R76.11. This question is about coding a positive finding from a screening test for tuberculosis in the absence of active disease. The keywords are positive tuberculin skin test, TST, and no evidence of active disease. A positive TST or Mantoux test indicates exposure to tuberculosis but not necessarily active infection. These findings are classified as abnormal findings on diagnostic investigation. Looking in the index under Test, Tuberculin, positive directs you to R76.11, nonspecific reaction to tuberculin skin test without evidence of active tuberculosis. A 15.9 is for active respiratory TB, Z22.8 is for carrier status, and B90.9 is for sequelae of TB. When the documentation indicates a positive TB test but rules out active disease, the R code indicating the abnormal finding is appropriate. Question 15. A patient is diagnosed with infectious mononucleosis with hepatitis. What is the correct code sequencing? A. B27.90, K77. B. B27.90, K71.0. C. B27.90, K77.0. D. K77.0, B27.90. Answer: C. B27.90, K77.0. This question involves coding an infectious disease with a manifestation in another body system. The keywords are infectious mononucleosis with hepatitis. Infectious mononucleosis is coded from category B27. Since no specific type is mentioned, B27.90, infectious mononucleosis, unspecified, is appropriate. Hepatitis in this context is a manifestation of the mononucleosis. The guideline for coding infections with manifestations states to code the underlying infectious disease first, followed by the code for the manifestation. Looking up mononucleosis, infectious, with hepatitis in the index confirms this sequencing and directs you to code B27.90 first, followed by K77.0, liver disorders in diseases classified elsewhere, which is the code for hepatitis as a manifestation. Question 16. A patient develops osteomyelitis of the femur following a compound fracture that was infected. The organism is Staphylococcus aureus. What is the correct code sequencing? A. S72.301A, M86.9, B95.6. B. M86.351, S72.301A, B95.6. C. M86.351, B95.6, S72.301A. D. S72.301A, M86.351, B95.6. Answer: B. M86.351, S72.301A, B95.6. This question involves coding an infection related to a trauma, specifically post-traumatic osteomyelitis. The keywords are osteomyelitis of the femur, following a compound fracture, infected, and Staphylococcus aureus. The guideline for coding complications of trauma, including infections, directs you to code the complication first, followed by the injury code. Post-traumatic osteomyelitis of the femur is coded in M86.351, other chronic osteomyelitis, femur. The acute fracture of the femur, S72.301A for unspecified part of femur, initial encounter for closed fracture, assuming it's the shaft, is coded second. While Staphylococcus aureus is the organism, it's already implied by the staphylococcal options in the M category for osteomyelitis. M86.351 falls under other chronic osteomyelitis, which often doesn't have specific organism options. If there was a specific code for staphylococcal post-traumatic osteomyelitis that would be used, an AB code might not be needed. In this scenario, M86.351 is the most specific code for the chronic osteomyelitis after trauma. However, re-evaluating the M category for osteomyelitis reveals codes for specific types and organisms. Let's assume the question implies chronic post-traumatic osteomyelitis. M86.3 series is for other chronic osteomyelitis. Looking under osteomyelitis, post-traumatic in the index directs you to M86. Sequence the M code first. Given the options, M86.351 for chronic osteomyelitis of the femur is presented first, followed by the fracture, and then the organism. However, the organism code B95.6 is generally supplementary and not always needed with specific organism codes for the infection itself. Let's revisit the sequencing rule. Code the complication first. The osteomyelitis is the complication of the fracture. So the osteomyelitis code should come first. M86.351 is the code for chronic osteomyelitis of the femur. The fracture code is S72.301A, assuming unspecified part and initial encounter, though laterality and encounter might differ in a real scenario. The organism Staphylococcus aureus could be coded with B95.6 as an additional code, but only if the M code doesn't already specify the organism, or if the guideline requires it. Let's look at the M86 category closely. M86.3 is other chronic osteomyelitis. M86.8 is other osteomyelitis. There isn't a specific code for staphylococcal chronic osteomyelitis in the M86.3 series that would negate the need for B95.6. Therefore, the most logical sequencing, coding the complication first, is M86.351, followed by the cause, the fracture S72.301A, and then the organism B95.6 as an additional code. However, none of the options perfectly match this. Let's re-examine the options and consider common coding patterns. Often, when an infection complicates a trauma, the infection code is primary, and the trauma code is secondary, especially if the infection is the focus of treatment. But post-traumatic conditions are often coded with the post-traumatic condition first. Let's look up osteomyelitis, post-traumatic, in the index again. It leads to M86-. The instructional note under M86 says use additional code to identify infectious agent, B95-B97. This confirms we need a B code. Now for sequencing. If the patient is being treated for the osteomyelitis should be the principal diagnosis. So M86.351 first. Then the fracture code S72.301A as the underlying cause. And finally B95.6 as the additional code for the organism. Option B, M86.351, S72.301A, B95.6 aligns with this. This question is tricky because it combines trauma and infection guidelines. The concept is coding complications of trauma, where the complication code, osteomyelitis, is primary, followed by the injury code, and an additional code for the organism. Always prioritize coding the condition that is the focus of treatment and follow sequencing rules for complications and infectious agents. Question 17. A patient is diagnosed with septic arthritis of the left knee due to Streptococcus pyogenes. What is the correct code? A. M00.062, B95.0. B. M00.062. C. L08.0, M00.062. D. B95.0, M00.062. Answer: A. M00.062, B95.0. This question requires coding bacterial arthritis with a specified organism. The keywords are septic arthritis of the left knee and due to Streptococcus pyogenes. Septic arthritis is classified in Chapter 13, Diseases of the Musculoskeletal System, but is caused by an infectious organism. M00.062 is the code for streptococcal arthritis, left knee. While the code M00.062 already indicates streptococcal as the cause, the instructional note under category M00, pyogenic arthritis, states use additional code to identify infectious agent, B95B97. Therefore, you need to code both the condition with the specified site, M00.062, and the specific infectious agent, Streptococcus pyogenes, B95.0. The M code is sequenced first as it describes the primary condition being treated. Remember that sometimes codes in other chapters require an additional code from Chapter 1 to fully identify the causative organism. Question 18. A patient is admitted with a diagnosis of suspected COVID-19. The test results are pending. What is the correct code? A. Z20.828. B. Z03.818. C. U07.1. D. R05. Answer: B. Z03.818. This question tests your knowledge of coding for suspected conditions when the diagnosis is not yet confirmed. The keywords are suspected COVID-19 and test results are pending. When a patient is being evaluated for a suspected condition that is ruled out or the diagnosis is not confirmed during the encounter, you typically code the signs and symptoms or the reason for the encounter, e.g., screening, observation. Z03.818 is the code for encounter for observation for suspected exposure to other biological agents ruled out. While Z20.828 is for contact with and suspected exposure to other viral communicable diseases, including COVID-19, Z03 codes are used specifically for observation for suspected conditions that are being ruled out. U07.1 is used for a confirmed diagnosis of COVID-19. R05 is for cough, a symptom. When the diagnosis is suspected but not confirmed, focus on coding the reason for the visit or the symptoms being investigated. Question 19. A patient presents with fever and rash. After evaluation, the diagnosis is confirmed as measles. What is the correct code? A. R68.82, R21. B. B05.9. C. R68.82, R21. B05.9. D. R68.82. Answer: B. B05.9. This question asks for the code for a confirmed infectious disease, measles. The keywords are fever and rash, symptoms, and diagnosis is confirmed as measles. Once a definitive diagnosis is made, you code the confirmed diagnosis, not the symptoms that led to it. The code for measles is found in Chapter 1. B05.9 is the code for measles, unspecified complication. Since no complications are mentioned, this is the appropriate code. You do not code the symptoms, fever are 68.82 and rash are 21, when the underlying cause, measles, is identified. Always prioritize coding the definitive diagnosis over symptoms when the diagnosis is known. Question 20. A patient has a confirmed diagnosis of COVID-19 with pneumonia. What is the correct code sequencing? A. J12.89, U07.1. B. U07.1, J12.89. C. U07.1, J18.9. D. J18.9, U07.1. Answer: B. U07.1, J12.89. This question tests the specific coding guideline for COVID-19. The keywords are confirmed diagnosis of COVID-19 with pneumonia. The guideline states that for a confirmed diagnosis of COVID-19, code U07.1 is assigned. When COVID-19 is associated with respiratory manifestations like pneumonia, bronchitis, or ARDS, code U07.1 is sequenced first, followed by the codes for the manifestations. Pneumonia due to COVID-19 is typically coded with J12.89, other viral pneumonia. Therefore, the correct sequencing is U07.1 followed by J12.89. Always remember the specific guideline for coding confirmed COVID-19 infections and their associated conditions. Question 21. A patient is being seen for follow-up after completing treatment for syphilis. The syphilis is now considered healed. What is the correct code? A. A53.0. B. Z86.16. C. A50.9. D. B94.8. Answer: A. A53.0. This question asks about coding treated or healed syphilis. The keywords are follow-up after completing treatment and syphilis, now considered healed. While Z86.16 is for personal history of other infectious and parasitic diseases, the ICD-10-CM codes for syphilis, A50, A53, include categories for latent syphilis, A51.4X, A52.1X, and other and unspecified syphilis, A53. A 53.0 is the code for latent syphilis, unspecified as early or late. This code is used for cases of syphilis that are not active but have not been fully eradicated or where the stage isn't specified as early or late latent. Using a history code, Z86.16, is generally appropriate when the condition is fully resolved and there are no sequelae coded elsewhere. However, A53.0 represents a state where the syphilis infection is present but inactive or latent, which is a more specific description than a simple history code. Codes from A50 are for congenital syphilis, which is not applicable here. B94.8 is for sequelae of other and unspecified infectious and parasitic diseases, not specifically syphilis. When coding syphilis that is no longer active, refer to the categories for latent or unspecified syphilis unless sequelae are documented. Question 22. A patient has external hordeolum, STI, of the eyelid caused by Staphylococcus aureus. What is the correct code? A. H00.019, B95.6. B. H00.019. C. L00, B95.6. D. B95.6, H00.019. Answer: B. H00.019. This question involves coding a localized infection of the eyelid with a specified organism. The keywords are external hordeolum, STI, of the eyelid and caused by Staphylococcus aureus. Hordeolum is an infection of the eyelid glands, classified in Chapter 7, Diseases of the Eye and Adnexa. H00.019 is the code for external hordeolum, unspecified eye, unspecified eyelid. While the organism is given, the codes in category H00 already imply a bacterial origin, commonly staphylococcal. Similar to the skin abscess example, an additional code from B95-B97 is generally not required when the code for the condition itself implies the common bacterial cause or if the guideline for that specific condition doesn't mandate it. Coding H00.019 is sufficient to describe the condition. Focus on finding the most specific code for the condition in its primary chapter before considering adding an organism code. Question 23. A patient is diagnosed with sepsis due to an indwelling urinary catheter, with the organism identified as Enterococcus faecalis. The patient also has acute kidney injury due to the sepsis. What is the correct code sequencing? A. T83.511A, A41.81, N17.9, R65.20. B. A41.81, T83.511A, R65.20, N17.9. C. A41.81, R65.20, N17.9, T83.511A. D. A41.81, R65.20, T83.511A, N17.9. Answer: C. A41.81, R65.20, N17.9, T83.511A. This question involves complex coding of sepsis due to a device, with specified organism and organ dysfunction. The keywords are sepsis due to an indwelling urinary catheter, organism identified as Enterococcus faecalis, and acute kidney injury due to the sepsis. The guideline for sepsis is to code the sepsis first. A 41.81 is the code for sepsis due to Enterococcus. Since acute kidney injury is present, indicating severe sepsis, R65.20, severe sepsis without septic shock, is coded next. The acute kidney injury, N17.9, is coded as the manifestation of severe sepsis, following R65.20. Finally, the complication code for the indwelling urinary catheter infection, T83.511A, infection and inflammatory reaction due to indwelling urinary catheter, initial encounter, is coded last as the underlying cause of the sepsis, according to the guideline for complications associated with medical devices causing infection. This sequencing prioritizes the sepsis and its severity/manifestations over the device complication that initiated it. Question 24. A patient presents with symptoms of food poisoning after eating contaminated shellfish. The organism is later identified as Vibrio vulnificus. What is the correct code? A. A05.9, B33.8. B. A05.4. C. B33.8. D. A05.9. Answer: B. A05.4. This question requires coding food poisoning caused by a specific bacterium. The keywords are food poisoning after eating contaminated shellfish and organism is later identified as Vibrio vulnificus. Chapter 1 includes codes for other bacterial food poisoning. Looking in the index under food poisoning, Vibrio vulnificus directs you to A05.4. A05.9 is for unspecified bacterial food poisoning. B33.8 is for other specified viral diseases, which is incorrect as Vibrio vulnificus is a bacterium. When the specific bacterial cause of food poisoning is identified, use the combination code that specifies the organism. Question 25. A patient is diagnosed with acute poliomyelitis. What is the correct code? A. B91. B. A80.9. C. G04.90. D. B94.0. Answer: B. A80.9. This question asks for the code for acute poliomyelitis. The keyword is acute poliomyelitis. Poliomyelitis is an infectious disease caused by the poliovirus. Codes for acute poliomyelitis are found in category A80. A80.9 is the code for acute poliomyelitis, unspecified. B91 is for sequelae of poliomyelitis, which is a chronic condition after the acute infection. G04.90 is for encephalitis, myelitis, and encephalomyelitis, unspecified, which is too general. B94.0 is for sequelae of poliomyelitis. Since the documentation specifies acute poliomyelitis, the code from A80 is correct. Always distinguish between acute infectious diseases and their long-term effects, sequelae.